it's with Dr. Keith Millikan, who's a very well-known hernia surgeon internationally, especially here in Chicago. I've been interested in your opinion and if you've used it, how have you used it, and what's been your experience with GORE ENFORM?
So Mike, thanks for the introduction. As you know, I've been at Rush forever for 30 years, and my passion is complex hernias, and specifically complex ventral hernias. And we've, over the last probably 20 years, used all the different meshes, the bilayer synthetics, the biologic meshes, and now the bioabsorbable meshes. And we've had good results with all of them. The question is, which is the most physician-friendly, which is the one we have the least problems with, and which meshes give us the collagen deposition, stay around for a long enough time until the collagen gets there, and has the least amount of long-term complications. I started out with the biologics for anterior separations, but they were so expensive. Then we moved over to the bioabsorbables. The Phasix conformed. It looked like polypropylene. I couldn't tell the difference, but it wouldn't hold sutures. It would crack, and I wasn't happy with it when I saw it in open wounds that would get infected, not that were infected at first. Whereas the first time I used ENFORM was for an anterior separation, and the wound got infected afterwards and had to have a wound vac on it. And that ENFORM just stayed there for the entire time until the collagen plate started. So I was onto something with the ENFORM. Since that time, I went to Spain and learned the posterior separation Madrid technique. And we have 52 cases since September of 2019 with no recurrences, no seromas, no infections. I think there was one superficial infection in a patient I did a paniculectomy on, but had nothing to do with the posterior technique, and a 4-day hospital stay. It's just been wonderful for that population of patients. So, you know, I'd love to hear about your experience with ENFORM around the esophagus, because I would worry about any mesh around the esophagus.
Yeah, that's right. We've had a similar experience. So we've placed 137 ENFORM mesh at the hiatus for our paraesophageal hernia repairs since 2019. And we have, at the moment, no recurrences. I don't expect that to last. We like to follow our patients long term, and I'm sure we will have some at some point, but I expect it to be low. We went through a similar process, biologic mesh. They absorbed almost too quickly, and so recurrence rates, though better than without mesh, were still a bit high. And then we moved to BioA and had a great experience. We saw our recurrence rates drop. When ENFORM came along, we had all the benefits of BioA, but it was much easier to use. And we've had great outcomes with it. We've had no mesh problems at all, and I don't expect to have any. I feel very confident having the conversation with patients about the type of mesh they're getting, because it's not an animal product or cadaver product. It's a biomaterial. People are, very happy to have that type of mesh in them. And so we've had a great experience with it. I also like, for the hiatus, the shape of the mesh. It's 16 by 6 centimeters. That 6 centimeters is about perfect for the hiatus. And the 16 centimeters spans a good length of the diaphragm. And so again, makes me feel confident that I'm really reinforcing that area. And one particular case I can think of where I had to perform a relaxing incision on the diaphragm to the left side. Of course, when we close that, we worry that, are we going to have a hiatal hernia or a diaphragmatic hernia in the future over there? And so we placed a permanent mesh, a Gore-Tex mesh actually, and then over that the ENFORM mesh laid just perfectly over it. So I didn't have to worry about a permanent mesh being exposed to the stomach or transverse colon, etc. So the ENFORM mesh has been really easy to use. I really like it. It takes sutures extremely well. I incorporate the mesh into the crura, so it's very important that I have a mesh that's easy to suture through, and ENFORM is. So we've been very happy with it, and our outcomes so far have been excellent. And so it sounds like a similar experience to yours, and I'm glad to hear that. Now, of course, you do a lot of very complex ventral hernias. A lot of people from the Chicago area have come to you to learn how to do some of these techniques. Are there any other specific experiences that you've had with ENFORM that you'd recommend to other people?
My typical patient is the morbidly obese, current hernias, but ENFORM and the posterior Madrid technique makes it a nice operative day.
I think we're both in agreement that ENFORM has been a step up and definitely an advance in mesh repairs, and I haven't found any faults with it, so I've been very happy with it. Sounds
Absolutely,
like you
it's
have
been
too.
great talking to you today,
Good to
Mike.
see you. Yeah.